inside. He also discovered that. So researchers concluded that nature builds happiness more than when we're with our friends, actually. So compared to when we're alone, you can decide, do I want to be with my friends or do I want to be outside? If you choose to be outside alone, it actually will make you more happy than if you choose to be with your friends. So that's what the study concluded. So I thought that would be interesting for our discussion today. So that was kind of the brief history. Now we're going to go into the actual mechanism. It's more scientifically based, but the evidence for the human body and health system itself. So we're going to focus on 3 different categories for that. So first we'll go over the physical health benefits from a physiological standpoint. Then we'll go into the cognitive mental benefits to health. And then last we'll look at social emotional well-being. And then there's a couple other points that I'll make and then we'll wrap it up. So since Ulrich's study, we really collected a lot more specific data for looking at the mechanisms to human health, and it's fascinating. The human body actually has physiological responses to being in nature that we're not even aware of. So we're not even aware that it's happening, but our cells are communicating to trees and receiving information from trees when we're outside, and it's happening at the cellular level. So everything that we see, everything we hear, smell is a result of our brain taking in all of this visual, auditory, sensory information, processing it. And when our brains process this information, it causes beneficial effects for the entire body. So when you're smelling a pine tree, you're looking at a forest in the horizon, you're hearing birds in a tree, our bodies are communicating with our surroundings. And we have receptors on our cells that actually recognize the chemicals that trees are giving off, which are essentially essential oils. And our bodies have receptors that recognize these essential oils, and that's just one example of a mechanism that leads to these benefits in our health. So for the cardiovascular system, it leads to decreases in our blood pressure, our heart rate, it slows the stress response. So when we're going through the stress response and we are in nature or we have biophilic design elements in the indoor built environment, it's able to better bring the body back to a normal state a lot more quickly. The recovery is faster. For the immune system, they've actually found people that spend time in the woods, it increases your T cells of your immune system, the killer T cells, and even after you leave the woods, those levels remain elevated. So it's a sustained benefit, I think up to 2 weeks was what they found. And when we're in parks that are especially quiet, where there's less noise pollution, it reduces our blood pressure. There's a very strong association between the noise of a city and urban traffic and our blood pressure levels. So going into green space, being in a quiet park, by water, around trees, it reduces the blood pressure. And researchers have also questioned, if people are outside, is it just that they're more active? Is it the benefit of being physically active that's making them healthier and not the nature? But they have compared studies of walkers and people who walk in cities or on a treadmill inside versus people who walk in green space or in a forest. And they found that it is indeed nature, because the people who walk in nature actually have better health markers and metrics than the people who are still walking but inside or outside in a city. So it is the nature that makes us healthier. When it comes to cognitive benefits, there's many studies that have looked at the brain and what our brain is actually doing when we're outside or when we're looking at green space or biophilic design. And so in today's busy lifestyle, our attention is always directed and focused on different things. We're on our phones, we're on our computers, we're planning project tasks in a meeting, we're looking at budgets, we're doing admin work. And that all takes a lot of directed focus and attention and frontal lobe activity by the brain. The brain loves glucose, it's constantly active. But after a while, that becomes very fatiguing for the brain, and it depletes a lot of the resources that we have to carry out all these tasks. So when we're able to step away, take a break, go outside, go for a walk, it helps the brain take a rest and relax from all these activities. So if you've ever gone for a walk on your lunch break and you're walking outside and you come back and you feel more refreshed, you feel creative, you're better able to maintain your focus and come back to your work. So yes, part of that is going for a walk and getting the blood flowing. But if you notice, if you go for a walk in a park, in a quiet place, in the shade or in the trees, it actually has a much stronger effect in helping you return to work. So the effects are a lot stronger when we are outside near trees, especially if it's in a quiet place. So this is why routine connections with trees is really required, in my opinion. I would say trees are required for health. Spending time outside, it restores our mental capacity, so our brains can take a break and we can return better prepared. So in addition to improving our focus and our creativity in that way, it also increases our alpha wave activity in our brain, which you might have heard of. There's different brain waves. The Buddhist monks, meditators, yogis, they have very high alpha wave activity. And so alpha waves are the brain waves that put us in a calm and alert state where you're in the present moment, but you're not having those monkey thoughts, those monkey distractions. Well, I have to do this, I have to go here, do this, and you can't focus on your task because you have all these different thoughts. And so alpha waves keep us in that flow state where we're so focused and so engaged on our current activity that we are not thinking about anything else. And so doing meditation regularly has shown to build the alpha wave activity as well. But when we spend time in the forest and around trees, it actually helps us get to that state faster and sustain it. And doing that regularly actually builds gray matter in the brain. So it's not exactly true. There once was a narrative that once you lose brain cells, you can't get them back. But we're learning now with neuroplasticity, we can build our brain. And so trees can help us do this. So the more you can do, the better it is from a cognitive perspective. The last area I just wanted to touch on was the benefits to our social emotional health. And this is an especially fascinating area. And I think this is where we're going to see a lot more research come out in the future. South Korea has an entire social forestry division that's dedicated to this area of how forests affect overall well-being. And we're likely going to see more research coming out here. There's two areas that I wanted to focus on. One is looking at how green space and trees affect our social relationships and social connection. And the other one is how it helps us respond better to conflict or stress management. But there's one study I just wanted to highlight that kind of gives both examples. And so it was a study done in Chicago, and researchers compared crime rates among buildings in a housing project. And they looked at access to trees and vegetation as the variable, and they compared behaviors and crime among buildings that had access to trees and vegetation and those that didn't have access to trees. And what they found was that the buildings with the access to trees and vegetation actually had a 42% lower property crime rate, 56% fewer violent crimes, less aggression, and a lower murder rate compared to the buildings that didn't have access to trees. And so these were crimes that were happening within the housing project. And it just demonstrates that social connection, so neighbor crime is lower, but then also aggression was lower, murder rates are lower. But what's important about this is it's not just the exposure to nature that just all of a sudden made this happen. What's going on here is that green space and trees promote social cohesion. So when you have green space, it attracts people together. People are drawn to public spaces. They're more likely to come out to get to know their neighbors, build those connections. They're more concerned about each other. So that's what's going on there in that relationship. So trees in this way are not directly causing this, but they're rather a catalyst for the reaction to build social connection. And I just very quickly wanted to touch on a study that we did right in the medical campus in Buffalo about 10 years ago. We invested, it was a combination of grant funding, private and public funding, to change the urban streetscape of Ellicott Street. So Ellicott Street is kind of the main thoroughfare of the medical campus. We have a lot of employees. We have 16,000 employees on the campus. We have ambulances running past. We have patients who are looking for their appointments. We have 1 million annual patients every year. A lot of people, so we wanted the campus to look nice. We wanted it to be a safe place, aesthetically pleasing, and promote health. Essentially, we're a place where a lot of sick people come, so we want people to leave healthier. So we invested this money changing the streetscape. It was originally just a 2-lane street with parking on both sides, and we essentially changed it into an urban linear park. So you can see in the picture on the top left, that's an example of what it looks like now. So we have these meandering pathways. We removed a lane of parking to add a lot more trees, vegetation, shrubs, flowers. We have fountains, benches for people to sit. And so we partnered with the Food Systems Planning Lab at the University of Buffalo and did a pre-post study with employees and investigated how these changes in the built environment affected employee health and health behaviors. And so what we found after these changes were made, employees were a lot more physically active. They felt more safe on the campus. They perceived themselves to actually be healthier. And anecdotally, we've observed that there's a lot more people that are using the space. It attracts people when you have green space out. And it's not just employees, but also if you're from Buffalo, you're familiar where we neighbor Allentown and the historic Fruit Belt neighborhood, which is an underserved neighborhood. And this is benefiting them as well. But after COVID, we've seen the space isn't exactly as vibrant as it used to be, but it is being built back up right now. So the walkability is a lot better. It's a complete street. It's more bikeable. There's less vehicles, and the vehicles that are there are going, well, they should be going slower. They don't always, but the sample size was small. It was about 120 employees, but ultimately we concluded that these changes in the built environment by incorporating more urban, more trees to the urban landscape and more shrubs and grasses and greenery really contributed to improving health of the employees on the campus. And so one last point I just want to make before I have 2 more slides. If you take anything away from the presentation today, please remember this point. So in public health, we know that underserved neighborhoods, often residents have shorter lifespans. There's increased rates of disease, higher stress, and these are often can be characteristics of low income communities and neighborhoods. It's often more so an issue of systemic racism that's happening predominantly in our Black and brown neighborhoods and how services are distributed. Similarly to how we see the inequitable distribution of services, distribution of green space in our cities is not equitable. And if you look at cities across the US, in Europe, underserved low-income neighborhoods do not have the same level of access to green space as high-income neighborhoods. And what studies are finding is that when underserved neighborhoods do have parks and green space present, it's protective and it mitigates some of the poor health outcomes that are associated with living in an underserved area. So ultimately, green space has the largest impact on the most stressed and most underserved, vulnerable residents of our population, and that having access to green space, vegetation, and trees can add years to someone's life and boost their health outcomes. It adds health. So as public health practitioners, those of us on this call, landscape architects, planners, environmental advocates, we need to prioritize putting more trees, green space in underserved communities, because that ultimately will have the greatest impact on moving the needle of population health in the direction that we need to go in. Finally, I just wanted to share, so all this question about nature and benefits to health, how much is enough? Ultimately, they found every study, it's a dose-response relationship. So the more you can get, the better the health outcome. The outcomes keep getting better the more you immerse yourself in nature. Of course, you might be familiar with the nature pyramid that comes out of University of Virginia. So I have it down here, but they have a suggestion for how much nature we should be getting on a weekly, monthly, yearly basis. But if you go by Finland standard, their national recommendation is 5 hours per month in the woods to prevent depression. So that's the prescription I will leave you with today. That concludes what I have to share. Thank you for listening, and we'll see if we have any questions.
Thank you so much, Beth, for that excellent presentation. We do have a couple of questions that have come in. So I think right off of that last slide, One of the first questions was, is there an increasing benefit as a person engages more with nature or trees, such as taking a walk in the woods versus planting a tree?
I would definitely say there's different uses for different states that you're going through. So if you are feeling kind of stressed out and you need a friend, there's a stronger benefit if you go for a walk in the woods and bring a friend. There's a lot of data that shows if you're with other people, especially someone close to you, and you're out in the woods, it's really, really good for you. If you need time to think and kind of relax, and you need to get deep into thought, then they suggest going on your own, of course, being safe and all that, but being by yourself. So I don't know if that answers your question.
Sure. It's funny to hear you say that. I think anecdotally, obviously putting on a conference is a little bit stressful. And last night I had a friend invite me out to go for a hike in the woods, and it was probably the best choice, even based on what you just said, for doing the night before something really stressful. So great. We have another question that's come in, which is, have you ever seen health insurance companies invest in trees as a way to lower their costs for covering medical costs?
I wish. That's, I have not seen that. I have seen health insurance or heard from other medical districts investing in housing. I think we're getting there. I haven't seen it. It might exist, but I think we're moving in that direction. I mean, we have fruit and vegetable prescription programs now, so I think it's definitely moving in that direction.
Great. It looks like there's one last question, which was regarding the crime and social health studies that I think you referenced on one of your previous slides. What would you say to someone who says that those are anecdotal results and challenges their validity?
I would refer back to the study. I would refer back to the study and the authors, which I could refer to if someone is interested.
Yeah, it'd be great if you could put that link maybe in the chat here. And as a reminder, these chats and the Q&A will stay up for the next couple of weeks. So if people want to come back or pop in, you can pull out speaker info, you can review from these recordings and get some more information. So thank you again so much for this excellent presentation. Before we all wrap up this conference, though, I do want to have some closing remarks from our very important partner in this conference for the, what was it, 25% of our attendees today who said this was their first ReLeaf conference. Congratulations. Thank you for joining us. If you are new to ReLeaf as a program, it is a partnership between us here at New York State DEC and our advisory council, the New York State Urban Forestry Council. And I want to welcome for our closing remarks, the newly elected president of that council, Stephen. Take it away, Steve.
Hi, can you hear me?
Yep.
I am trying to turn on my camera. Should I be able to do that?
You should.
It says you cannot start your video, start my video, because the host has stopped it. Hi.
There we go, we see you.
Thank you.
Thanks so much.
Great, so thank you, Christina. It is an honor to serve as the president of the council. I want to acknowledge Karen Emmerich, our president for the last 2 terms. That's 4 years. As vice president of the council, I worked with Karen quite a bit. And Karen, I saw you were on earlier. You were a very stable presence for the council, and you handled the position and all of us with such grace. It was very appreciated, and thank you so much for your presidency. That's quite a job doing 2 terms. And it's great to see the Striving and Vibrant programs in Buffalo. I know you guys are working hard with what you got, and it's pretty neat to see what's going on. This is an exciting time to work in urban forestry. Trees are really starting to be called infrastructure, not just green infrastructure. And urban forests and trees are making the headlines in newspapers across the country. There's recently a really big article in New York Times opinion page about the disparity in tree cover in rich and poor neighborhoods. They're making those headlines because of their important role, as Beth just pointed out, especially for places that don't have trees, and what trees could be providing if they were there. The New York State Urban Forestry Council will be knee-deep in all these issues, and we invite you to help us get trees planted where they're needed most, and we're ready to be a resource for communities to help you know what trees to put in those places and how to get others involved. We're really excited about having the conference in person in 2022, hopefully, in Region 6, which extends up from St. Lawrence down to Herkimer. And until then, thank you for attending the conference and enjoy the summer.
Thanks so much, Steve. Thank you all for joining us today. Again, you'll watch your email. You'll be getting 2 emails here in the next half an hour, thanking you for attending with some important links to all of your continuing education credit surveys. I'll be putting the one for this up in just a moment after we finish. You do have to submit surveys for each session by the end of today, 7 o'clock. And again, feel free to keep engaging with your attendees, complete all those surveys, review stuff. We'll be putting up videos of these presentations over the course of the next week. And we thank you all for attending and look forward to seeing you next year.